Welcome back to our YouTube channel Medi-Concept. In the first part, we had discussed some diseases related with heme synthesis, that is called Porphyria. One disease was due to allosynthetase 2 deficiency, another is due to hepatic aldehyde or another name hepatic PBG synthase deficiency, and another is due to hepatic PBG deaminase or hepatic HMB synthase deficiency. Accordingly, the diseases are named as allosynthetase 2 when it is deficient or defective. It is known as X-linked sideroblastic anemia. I am telling again, this is not classified under Porphyria, it's a separate disease. When there is deficient or defective hepatic aldehyde or synonym hepatic PBG synthase, the disease is called acute hepatic porphyria. When there is defective or deficient hepatic PBG deaminase or hepatic HMB synthase, the disease is called acute intermittent porphyria. Now we will learn the other diseases. So, when erythropoietic UPG3 co-synthase is defective, the disease is called congenital erythropoietic porphyria. The defective enzyme is erythropoietic UPG3 co-synthase or synthase defect, either deficient or defective, and resulting in excessive UPG1 level in erythropoietic tissue, which can't be converted into UPG3 there. So they come out in systemic circulation, convert into CpG1. So there is increased level of both UPG1 and CpG1 in blood, and finally they oxidize to form uroporphyrin and coproporphyrin respectively. As all these compounds accumulated at tetrapyrols, so there is extensive photosensitivity complained by patients. As it is a erythropoietic variety of disease, so the patient suffer from anemia. Here I am telling again, hepatic UPG3 co-synthase is absolutely normal, so no hepatic manifestations are there. In the next step, the UPG3 with the help of UPG3 decarboxylase converts into CpG3 or coproporphyrinogen 3 in both the organs. Here the documented disease is known as Porphyria cutanea tarda. Porphyria cutanea tarda, in which the hepatic UPG3 decarboxylase enzyme is either deficient or defective, resulting in accumulation of UPG3 in hepatocyte. Then the accumulated product will come into systemic circulation, oxidize to uroporphyrin, will create clinical manifestation due to overaccumulation, and finally will excrete through urine. As the product is a tetrapyrrole. Which product here? It is UPG3. Where it is accumulated? It is accumulated in hepatocyte first. The disease, the cause lies within the hepatocyte. So, as tetrapyrrole compounds are accumulated first in the hepatocyte and finally in the systemic circulation, photosensitivity must be there. As it is a hepatic variety, so there is no question of anemia. The patient will not suffer from anemia here. Erythropoietic UPG3 decarboxylase is absolutely normal. As the skin involvement is maximum, hence the name cutanea, the adjective cutanea is coined. In the next step, in both the organ, from cytosol, CpG3 enter in the mitochondria with the help of specific transporter present here. You can remember from the first video that with the help of another transporter, ELA comes out from mitochondria to cytosol. Here, from cytosol, again they will enter within mitochondria. Which product? CpG3. Here within mitochondria, with the help of CpG3 oxidase, both hepatic CpG3 oxidase in liver and erythropoietic CpG3 oxidase in bone marrow, they convert into protoporphyrinogen 9. Documented disease is hereditary coproporphyria, in which hepatic CpG oxidase is either deficient or defective, resulting in accumulation of coproporphyrinogen 3 in hepatocyte. Then they will come into systemic circulation, oxidize to coproporphyrin, will create clinical manifestation due to overaccumulation, and finally excreted in urine. As CpG3 is a tetrapyrrole, so photosensitivity is there. As it's a hepatic variety, so there is no question of anemia again. Now here erythropoietic CpG3 oxidase is absolutely normal. This enzyme has no problem, so no anemia is there. And the name is coined according to the product obtained in urine. Here it is coproporphyrinogen. So the name is hereditary coproporphyria. In next step, with the help of protoporphyrinogen oxidase or protoporphyrinogen 9 oxidase, protoporphyrinogen 9 converts into protoporphyrin 9. The documented disease here is variegate porphyria or porphyria variegata, in which again hepatic PPG oxidase enzyme is either deficient or defective, resulting in accumulation of protoporphyrinogen 9 in hepatocyte. Then they will come into systemic circulation, create clinical manifestation due to overaccumulation, and finally excreted in urine. Unlike other varieties, please remember here protoporphyrinogens are obtained from urine, not the porphyrins. But as it is a tetrapyrrole, so photosensitivity must be there. As it is hepatic variety, so there is no question of anemia. The erythropoietic PPG oxidase is absolutely normal, so no anemia is there. So we can see that when there is hepatic PPG oxidase is either deficient or defective, the name of the disease is variegate porphyria. In the last step, with the help of heme synthase or ferrochelatase, iron is already present there, but iron in the ferrous form is incorporated within the protoporphyrin 9 to form heme. Here documented disease is erythropoietic protoporphyria, in which the heme synthase or ferrochelatase, the erythropoietic variety of heme synthase or ferrochelatase is either defective or deficient, resulting in accumulation of protoporphyrin 9 within the bone marrow. They come to systemic circulation, create clinical manifestation due to overaccumulation, and finally excreted in urine. As the product is a tetrapyrrole, the protoporphyrin 9 is a tetrapyrrole. Obviously it is. So here also photosensitivity is an important clinical manifestation. As it is a erythropoietic variety, so anemia is definitely there. And Hepatic heme synthase or hepatic peroxidase is absolutely normal here. So to summarize the porphyria, when there is defective hepatic aldehyde, the name of the disease is acute hepatic porphyria. When the defective enzyme is hepatic PBG deaminase, it is acute intermittent porphyria. When the name of the defective enzyme is erythropoietic UPG3 co-synthase or synthase, it is called congenital erythropoietic porphyria. When the defective enzyme is hepatic UPG decarboxylase, the name of the disease is Porphyria cutánea tarda. When the defective enzyme is hepatic CpG oxidase, the name of the disease is hereditary coproporphyria. When the defective enzyme is hepatic PPG oxidase, the name of the disease is variegate porphyria or porphyria variegator. When the defective enzyme is erythropoietic heme synthase or peroxidase, the name of the disease is erythropoietic protoporphyria. And last but not least, when erythropoietic allosynthetase or allosynthetase is defective, it is called X-linked sideroblastic anemia. But I am telling again, that is not included under the heading porphyria. Porphyria, often some author connected with the famous story of the vampire or Dracula, but actually those are novel based, and all of you should know that sucking blood is not a treatment of porphyria, but appropriate blood transfusion must be there if it is a particular variety of porphyria where the patient is anemia.